Imagine you're a seasoned horse breeder, right? Meticulously planning your next season. Everything seems on track. Then you notice something unusual.
Mm-hmm.
Maybe just a tiny, almost imperceptible pink tinge in your prize stallion's ejaculate. What seems like such a small detail, a fleeting observation,
Yeah.
it can actually be the first sign of a much larger, really complex puzzle. Today, we're taking a deep dive into hemospermia in stallions. That's the presence of blood in a stallion's ejaculate.
Right.
We've got two incredibly detailed sources today, both titled Hemospermia in Stallions, Diagnosis and Treatment. One's kind of a broad overview. The other, it's a specialist-level study guide.
Mm-hmm. Quite comprehensive.
Yeah, together they've given us just a treasure trove of precise information.
Absolutely.
So our mission is to sort of fast-track your understanding of this surprising, often misunderstood condition. We'll uncover not just what hemospermia is, but why it's such a significant concern in equine health and exactly how veterinary experts tackle it.
And what's really insightful here, I think, is how a seemingly simple observation, blood where it absolutely shouldn't be, it just quickly unravels into this whole world of intricate diagnostic challenges and, diverse treatment pathways.
Yeah.
It truly highlights the nuanced nature of veterinary medicine.
So let's unpack this then. Our sources define hemospermia pretty clearly. It's the contamination of an ejaculate with blood.
Straightforward enough.
And it runs the full spectrum, right?
Yeah.
From a barely noticeable pink tinge all the way to frank hemorrhage, which I take it means quite a lot of obvious blood.
Exactly. Frank hemorrhage is unmistakable. And while a physical exam when the stallion is just, standing at rest is usually unremarkable.
Nothing obvious, maybe.
Right. The most common thing you'll actually see is that discoloration of the semen itself. Now, in natural breeding situations, you might observe blood, maybe dripping from the penis on dismount, or sometimes at the mare's vulvar lips after breeding. And sometimes, the only clue is simply that mares aren't becoming pregnant.
Ah, so it can be subtle.
It can, and it's also worth noting, some stallions might concurrently have hematuria, that's blood in the urine, which points towards maybe a urinary tract issue complicating things.
Okay, here's where it gets really interesting for me. Beyond just the visible blood, why is this such a big deal? For the stallions, for the breeders, what are the real implications here?
Well, the primary concern, absolutely, is fertility impairment. And we're not just talking visible blood. Even microscopic amounts are profoundly spermicidal.
Spermicidal, okay. That sounds bad.
It is. Think of it like this. Blood contains iron, inflammatory components. Yeah. It creates this oxidative stress nightmare for sperm.
Like rusting them.
Sort of. It's essentially chemical warfare in the ejaculate, crippling their ability to swim, their viability, their ability to fertilize. This makes every single drop, even tiny amounts, a critical problem. It drastically reduces motility, viability, and ultimately conception rates.
Wow.
Yeah, it really raises the question, how does something that, might seem minor become such a devastating barrier to successful breeding?
And you connect that directly to breeding programs. Reduced conception rates obviously lead to a significant economic impact.
Mm-hmm. Absolutely.
This hits stallion performance directly, and I imagine can result in considerable financial losses for breeders counting on those successful seasons.
No doubt. And beyond the economics, there's a crucial welfare concern.
Mm-hmm.
The presence of blood, it's always a red flag. It indicates an underlying pathology.
Right, something's wrong.
Exactly. This isn't just cosmetic. It means there's something genuinely wrong internally that needs medical attention, maybe even surgical intervention, to ensure the animal's well-being and, frankly, comfort.
Speaking of the animals, the signalman who gets this tells us all stallions can be affected. But here's a surprising fact you pointed out from the sources. Quarter horses seem to be overrepresented for tiers of the urethral mucosa.
It's a fascinating anomaly, isn't it? While our sources don't fully explain why, this overrepresentation suggests there might be, unique anatomical things going on, or maybe even breeding mechanics specific to quarter horses that put them at higher risk. Yeah, it's definitely a key area for more research and maybe targeted prevention within that breed.
Okay, so once we see blood, the immediate next question is, naturally, where is it coming from? Our sources say it can originate from an external lesion, like an injury to the urethral process or the penis itself.
Right, something visible on the outside.
Or, more complexly, from an internal lesion.
And when we look at the top two causes that one source highlights, they point straight to trauma, think lacerations, cuts on the urethral process, the tip of the penis or the body of the penis, often from something like tail hair during breeding.
Tail hair, wow.
Yeah, it can happen. And a specific trauma example mentioned is a stricture of the urethra, like a narrowing from, say, chronic placement of a stallion ring without proper monitoring or cleaning.
Ah, okay.
The second top cause listed is urethral defects, or urethritis, which is basically inflammation of the urethra.
That sets the stage, but the specialist guide really goes deeper, right? It highlights a very systematic approach to localizing the source. This is where it gets complex.
You're spot on. And that systematic approach is absolutely critical because, while the signs might look similar, pinpointing the exact origin, well, that can be incredibly challenging, get it wrong, and the treatment's off.
Makes sense.
So the most common origins, our sources explain, are pre-ejaculatory, or from the accessory sex gland origin. Think glands involved before the main ejaculation.
Okay.
Within this category, urethritis, or urethral lesions, are key, and specifically dorsal urethral wall tears, particularly at the ischial arch, that bend in the urethra near the pelvic bone.
Right, you mentioned that bend.
Those are described as the most common cause,
Mm-hmm.
often associated with, vigorous erection or breeding, leads to pressure necrosis, or just direct trauma.
Okay.
Other urethral issues, stones, rare foreign bodies, or those strictures we mentioned. Then we also commonly see inflammation of the accessory glands, like the ampulitis or the seminal vesiculatus, the internal gland. Exactly. Often ascending infections, sometimes caused by specific bugs like Tailorella equigenitalis, or more common ones like E. coli. These might present with palpable enlargement, pain, maybe a purulent pus-like discharge mixed in with the blood.
Oof.
Yeah. Prostatitis is less common in stallions, apparently, and bulbar arthritis can also occur.
So we've covered the common suspects, the usual lineup, but a good detective doesn't stop there, right? What about the less common but still critical sources vets need to consider?
Absolutely. For testicular or epididymal origin, we're talking things like epididymitis or orchitis. That's inflammation of the epididymis or the testes themselves, often infectious or traumatic.
Yeah.
Rarely, you might see highly vascularized testicular tumors, like Sertoli's cell tumors bleeding. And in severe cases, testicular torsion, a twisting of the spermatic cord that can definitely lead to hemorrhage.
Ouch. Okay, next category. Sources that are post-ejaculatory, meaning issues from the prepuce or the penis itself. Stuff happening on the outside, basically.
Right. Here, trauma like penile or preputial lacerations and abrasions from breeding activities, maybe mounting fences, getting kicked, other coital injuries that can cause blood to contaminate the ejaculate after it leaves the urethra.
Makes sense.
Specific skin conditions include habroneumiasis, often called summer sores, nasty granulomatous ulcerative lesions caused by a parasite, and they bleed easily.
Ugh, summer sores.
Yeah. And then squamous cell carcinoma, that's another common tumor of the penis or prepuce, often ulcerated, prone to bleeding. And of course, a simple penile hematoma from direct trauma is also possible.
And finally, there's a potential connection to the urinary tract origin, where blood in the urine, hematuria, might contaminate the ejaculate.
Yes, exactly. This could be from cystitis, bladder inflammation, or urolithiasis, which are bladder stones. Nephritis, or pyelonephritis, kidney disease, is less likely to cause gross hematuria just in the ejaculate, without other systemic signs being obvious. And sometimes, urethral sphincter dysfunction can allow urine to flow backward into the ejaculate, contaminating it if there's blood coming from anywhere in the urinary tract.
So just to quickly recap some of those general causes and risk factors,
Yeah.
we're broadly talking infections, inflammation of those accessory sex glands, and also certain cancers like squamous cell carcinoma or papillomas. Risk factors seem to often involve the breeding activity itself causing infections or lacerations.
Right, physical act.
And for things like habroneumiasis, those summer sores, hot, humid weather is definitely a factor.
Absolutely. Environment plays a role there.
Okay, so once blood is actually observed, the real detective work kicks in. The goal, I guess, is a really thorough, systematic approach to pinpoint that exact source. What does that involve?
Exactly. Diagnosis, fundamentally, it's based on seeing the ejaculate's color, usually when collected by an artificial vagina, or AV, and then confirming it by finding red blood cells under the microscope.
Microscopic confirmation.
Yep. And a key technique here is fractionation of the ejaculate. Using an open-ended AV lets you collect the ejaculate in parts or fractions.
Oh, interesting. How does that help?
Well, it can help determine the source. If blood is mainly in the initial fractions, it suggests a more distal source further down the tract. If it's kind of throughout,
Proximal, maybe.
could be more proximal, yeah. And if it's primarily in the final fraction, it points towards an accessory gland, or maybe even the bladder origin is like breaking down the crime scene into smaller pieces.
Clever. So once that initial observation of blood is made, Where does the detective work truly begin on the ground? I imagine a thorough history and physical exam are absolutely foundational. What are you specifically looking for there?
Absolutely, that's ground zero. You need all the details, the stallion's breeding history, his general health status, and then a very careful visual inspection of his external genitalia. But crucially, a rectal palpation.
Right, the internal exam.
Yeah, feeling those accessory sex glands, the ampullae, seminal vesicles, prostate through the rectal wall. This lets us check for things like unusual size, symmetry, consistency, any signs of pain, heat, adhesions, maybe abscesses. This step is absolutely essential for catching things like ampulitis or vesiculitis.
Okay.
And while you're there, you also palpate the pelvic urethra and the bladder itself.
Got it. So once you have that detailed history and physical exam, the next crucial step is semen evaluation. Looking at the semen itself, I imagine you're checking everything from how it looks grossly color, uniformity, volume, down to the microscopic details like red cells, white cells, bacteria.
Absolutely. That semen evaluation is really where the rubber meets the road.
Yeah.
Because as our sources really emphasize, blood is spermicidal.
Right.
So it's vital to assess not just its appearance, but precisely how it's impacting sperm motility and morphology at the cellular level. This tells us directly about the extent of the fertility problem.
Okay, so we've talked about the foundational detective work history, physical semen evil, but what about the more advanced tools in the vet's toolkit? This is where the deep dive gets pretty literal, I guess.
Precisely. This is where we bring in the technology, things like endoscopy, which our sources highlight as an absolutely crucial diagnostic tool.
Looking inside with a camera.
Exactly. Urethrooscopy involves passing an endoscope, flexible or rigid, right into the urethra. This lets us see the entire length, looking for any rents, tears, granulomas, polyps, strictures, even stones.
And you find things often.
Oh, yeah. It's noted that those dorsal urethral rents at the ischial arch, that common tear at the bend, are a common finding. We can also extend this with cystoscopy, going into the bladder to check for inflammation, stones, or masses.
Okay.
And for really complex cases, there's vesiculoscopy or ampuloscopy. This involves passing a tiny endoscope into the actual ducts of the seminal vesicles or ampullae for direct visualization inside them. That, as you might imagine, requires significant expertise.
Wow, that sounds delicate. Beyond direct visualization, what about imaging? Specifically transrectal ultrasonography or TRIRES.
TRUES is incredibly useful, yeah. It's pretty essential for a detailed evaluation of those internal accessory sex glands.
What can you see on ultrasound?
We're looking for signs like enlargement, maybe thickened walls, fluid or pus inside the glands, abscesses, stones, changes in echogenicity.
Echogenicity.
That's just how bright or dark the tissues appear on the scan. Changes often signal inflammation or other issues. TRUS can even guide a needle if we need to take a sample and aspiration for further testing.
Handy?
Very. Urethral contrast radiography is another option, using dye and x-rays, but it's generally less sensitive than getting a direct look with endoscopy.
Okay. And to wrap up this comprehensive diagnostic phase, we have laboratory diagnostics. What kind of lab work?
Yes, this includes semen culture and sensitivity. Absolutely essential if you suspect an infection, guides your antibiotic choice.
Makes sense.
Then cytology, looking at the cells in the semen or maybe secretions collected from the accessory glands. Finding inflammatory cells gives us clues about what's going on. And then urinalysis and urine culture are important to rule out or confirm any underlying urinary tract problems that might be contributing blood.
Got it.
And it's crucial to remember, as the sources state, a complete breeding soundness examination, BSE, should really be performed. Hemospermia directly hits fertility, so you need that full picture of the stallion's reproductive health.
Okay, so diagnosis complete, cause identified. What are the treatment options? The first thing our sources stress is that all conditions warrant sexual rest. Seems logical.
That's right, complete sexual rest. And we're talking anywhere from 30 days up to 90 days, or basically until we can confirm healing, often with a follow-up endoscopy, is absolutely paramount.
No breeding, no collection.
Exactly. And importantly, collection of semen via AV is generally not recommended during this rest period, as it can just aggravate the lesion.
Right. Okay, let's look at specific approaches, starting with those common urethral rents or lesions. What do you do for those?
For these, the conservative approach is just that strict sexual rest. Though the sources note it has limited success for some, especially maybe bigger or chronic tears.
So surgery might be needed?
It might. Surgical options include an ischial urethrotomy, where an incision is made into the urethra down near the ischium to access and repair the tear, or sometimes laser surgery or other reconstructive techniques. These more invasive options definitely require a minimum of 2 months of sexual rest afterward to heal properly.
Okay.
And alongside rest or surgery, NSAIDs, non-steroidal anti-inflammatories, are used for the inflammation and just for comfort. The practice of urine acidification is mentioned, though debated, as potentially helping healing in some cases.
Interesting. What about infections, like infection or inflammation of the accessory sex glands, vesiculitis, and colitis?
Antimicrobial therapy is the key here, obviously. Now, systemic antibiotics like trimethoprim sulfamethoxazole, given orally or injected, are often used, but they can be frustratingly ineffective sometimes because the drug doesn't penetrate well into those glands.
Ah, delivery problem.
Exactly. So a more targeted approach, local infusion, is often more effective. Think lavage of the glands, flushing them out, and then infusion of an antibiotic directly into the vesicular glands, often done endoscopically right at the source.
That makes sense.
But even then, high doses and prolonged courses, we're talking 3 to 6 weeks, maybe even longer, are often needed to clear the infection. And sexual rest, of course, is continued throughout. Surgical removal of these glands, very rare, really a last resort for chronic, intractable cases.
Okay. For penile or preputial lesions, the external stuff, what's the typical plan?
Trauma, like cuts or scrapes, often just needs good outpatient care cleaning, hygiene, maybe some topical treatments, and crucially parasite control to prevent secondary problems like infection or fly strike.
Mm-hmm.
Habernemiosis, those summer sores, involves parasite control with drugs like ivermectin, plus potentially cryotherapy freezing the lesion, or surgical removal if they're large or persistent.
And cancer, like squamous cell carcinoma.
Yeah, neoplasia like SCC can involve cryotherapy, hyperthermia, which is heat treatment, simple local excision, maybe a reefing operation, which surgically removes some excess prepuce if the tumor is located there, or, for extensive cases, unfortunately, phylectomy, partial or even full removal of the penis.
Wow, serious stuff. And briefly, other treatments for the less common sources.
Sure, urethritis itself typically involves antibiotic therapy based on culture if possible. Urinary tract issues might mean antibiotics for cystitis or surgical removal for urolithiasis, those bladder stones. For testicular or epididymal pathology, treatments could include antibiotics, anti-inflammatories, cold compresses to reduce swelling, sexual rest, and sometimes, if one side is badly damaged and non-functional, unilateral castration might be recommended. And it's important for owners and vets to be aware of possible complications from hemospermia, even after successful treatment. These can include things like ongoing infertility or subfertility.
Even if the bleeding stops.
Yeah, the damage might be done. Also, urethral stricture or adhesions, scarring that narrows the urethra, adhesions of the vesicular glands internally, and in really severe untreated cases, you could even see a ruptured urinary bladder, though that's thankfully rare.
So what's the bottom line? The outlook for a stallion with hemospermia, the expected course and prognosis obviously depends on the cause and severity, as you said.
It really does. A crucial point here is that there's generally a good prognosis for minor urethral rents that heal well with just sexual rest, and also for treatable accessory gland infections if caught reasonably early and treated appropriately.
Okay, that's hopeful.
It is. But it quickly becomes guarded to poor prognosis for chronic, severe, or recurrent urethral rents, the ones that keep coming back or don't heal well. Also for extensive accessory gland infections, or certainly for malignant tumors.
Right.
And it's really vital for breeders to understand that even with successful treatment of the bleeding, the underlying sperm quality may take significant time to recover, or could, unfortunately, be permanently compromised in some cases.
A sobering thought. And as with so many things, prevention is key. What does prevention avoidance look like here?
It comes down to good management, diligent parasite control, especially for Habernemiosis, good, careful management of stallions during semen collection to minimize trauma risk, and regular physical examinations, including checks of the genitalia, to catch any issues early before they become major problems.
Makes sense. Well, we've certainly taken a deep dive today into hemospermia. We've moved from what might seem like a subtle, maybe overlooked sign, to this really intricate network of potential causes, the precise detective work needed for diagnosis, and the targeted treatments required.
It really has underscored, I think, how critical a systematic and detailed approach is in veterinary medicine, and how understanding the so what behind a clinical sign, why it matters, impacts not just the animal's welfare, but also has those very real economic consequences for people in the breeding industry.
Absolutely. This deep dive into hemospermia in stallions really makes you think, doesn't it? About how many seemingly small symptoms in the animal world, or maybe even in our own lives, can just be the tip of a very complex iceberg.
Yeah.
Demanding such a detailed, precise investigation to truly understand and resolve, it makes you wonder what other seemingly minor physical signs out there might be just screaming for their own deep dive, waiting to reveal a whole hidden world of information.